the very first day of our workshop, uh, that is the Applied Data Science for Healthcare. So, I am Mrs. Pooja Gurde from Triple IT Nagpur. Let me introduce the speaker of the first session of the workshop. The session will be on Introduction to Data by Dr. Richa Makijani. Madam has completed her doctorate in CSE from VNIT Nagpur in 2019, and her specialization is in bioinformatics. She is having 14 plus years of experience in teaching, and her area of research is in bioinformatics, data analysis, and machine learning. I request Richa ma'am, please begin the session.
Thank you, Ms. Pooja. So I'll start with the session for today. I hope the screen is visible to all of you.
Yes, ma'am.
Yeah, thank you. So welcome all the participants to this first session of the 5 days workshop we have floated at IIIT Nagpur on applied data science for healthcare. And I am beginning with the topic of introduction to data. Now, let us try to have a discussion about what is healthcare and why we are talking about application of data science to healthcare. So, we now live in the era of data, and we can see that every sector of our industry, for example, education, be it commercial or healthcare, every sector is heavily loaded with data now. So every day we are just recording trillions of bytes of data from these sectors, and how it can help us in understanding or unraveling the complexities of various diseases. This is what we are trying to discuss. So let us just try to have an overview of what is healthcare data, because there are so many types of data, and why particularly we are insisting about healthcare. So healthcare analytics is based upon data and data sets, and why we are collecting data, just to have some kind of information or knowledge extracted from these data, which can help us in answering to the questions of relevant disorders, very complex diseases which we are not able to solve till now, or which we don't have any good pharmaceuticals or treatments to deal with. So, variety of healthcare data are available nowadays, and I've tried to just list down a few in this slide. You can see. Let's talk about the first one, which is the patient surveys. So, we are now very much familiar that, especially with the use of these Google groups or Google Forms and WhatsApp, we are able to get quick data or a quick survey from a particular audience. For example, let's say we have a set of patients which who are diabetic, then we can have a group of diabetes patients, and we can just float a Google form having, let's say, some questions related to what can be the um, just give me a minute. Yeah, I think the slides were not visible. I hope they are visible now. Yeah, thank you. So I'll continue. We are talking about collecting data basically, and which are the types of data which we can have. So I was talking about patient surveys. For example, we have a group of community of people suffering from diabetes, and we can have surveys uh, which are the kind of responses which are taken from those set of people. Let's say if they are the diabetic patients, then what is the diet pattern they followed for the last 1 week and how they are feeling. Let's say what is the set of exercises they have been doing, what are the other disorders they are dealing with, and if they are taking a certain type of medicine, how they are feeling and all that. So for a period of time, we can have a kind of time series analysis for this data, where we are collecting the patient responses over a fixed duration, for example a weekly response or a monthly response, based upon the complexity of the disease and treatment, no doubt. So you can see that now it is very easy that we can just design a Google form and we can float it among a community of people, and we can get the responses, and what you get the responses is nothing but the data which you have collected. So patient surveys are also a very good source from where you can actually help in understanding the patterns of a particular disease and the effects of certain exercises or some medication over the patients. Let's come to the second one, which is the patient medical records. So these are actually called as PMRs, and patient medical records are nothing but, let's say, nowadays we are having hospitals which are also trying to develop or maintain the data, not just in the form of the hard coded files or the paper files which we used to carry earlier, but to keep a record of those patients in their computers. So let's say a patient is visiting a doctor frequently, then his record is maintained by that hospital or that particular doctor, and if for every visit some of the information of what was the problem for which he visited, what was the medication or the treatment he was suggested, and then when he visits next time, what was the effect of this medication, and all that can be recorded. So we are having a lot of patients. Okay. Okay, just a minute.
मी आता आंघोळ केव्हा करू?
Are the slides visible? Please let me know. I hope there are no issues with the slide. Right. So I'll continue. Thank you so much. So patient medical records, as I said, which are not very prevalent in all the hospitals, or all the doctors are not following it, but yes, to some extent the big hospitals which we have in our metro cities are trying to do that. And then we have standardized clinical data. So what is clinical data? Clinical data is nothing but those parameters of the patients which are collected from the tests. For example, when you go for a blood test, then the parameters which are collected for your blood reports, for your CBC, what is the WPC count, RBC count, the HB, and all those can be a clinical parameter. So for a relevant test, we have some clinical data, and those standardized clinical data can also be maintained by some hospitals for, let's say, kind of pathological laboratories. This is the next data, which is the administrative data. It is very important to understand now, because when you now type on Google to find out what research is being done in healthcare informatics, you'll basically find that on the administrative level, that means the governments of our country as well, is trying to have a kind of centralized uh, data, where a centralized repository where the data of all the patients or electronic health records of all the citizens of the nation can be maintained. And then you come a lower level to the, let's say, the state government, and you come to the private hospitals or the central hospitals like the aims and all, are also trying to have some kind of administrative data. Now what do we mean by this administrative data? Now if, let's say, we are running a hospital, then what we need to understand is how many ICUs should we have, what are the kinds of diseases for which the patients are frequently visiting the hospital in this region, and what is the medical care that should be a minimum medical care that should be available in terms of, let's say, beds, the number of ICUs, the number of doctors, the number of hospital staff, the account section, and everything. So that comes under administrative data. Now how this administrative data is helping to help the healthcare industry is, we have right now seen in the COVID era, like in COVID in 2019 end, when we started with the COVID, we had seen that there was such a lot of chaos when they were not free beds, there were ICUs were not available, the oxygen cylinders were not available and all that. So this is all under administrative. So let's say in some region where we are having critical care should be provided for patients who are dealing with, let's say, severe heart attacks and all that. In that case, the hospitals are trying to maintain more number of ICUs and facilities which are related to helping the cardiovascular disease patients. And in this case, they need to understand that for the population or for the region, for their demographic region, what is the prevalent disease, how complex it is, what is the population in their region, and what type of facilities should be provided. So all this administrative data is also coming when the patient is going to the hospital. So when a patient is visiting the hospital, and let's say every day they are getting at least 5 heart patients in their hospital, then in that case they are trying to maintain a patient medical record for all those heart patients, and then they are trying to measure whatever the parameters for their heart. So how was their ECG, what were the pressure of the blood and all that. And then they want to just have a look at why this region is happening. So is there something related to the diet in that region which is causing this disease and all that. So many different factors which may lead to the occurrence of that disease. Administrative data is going to help them give that facility, maintain the facility for the patients, and give that first care or the first aid to those patients so that the disease can be handled on time. So administrative data is very important nowadays, and this is what is government which is more focusing on. Then we have comments from individual patients. So for example, if you have a frequent patient going for a, let's say, a heart disease, and he has recovered over the year, over a duration of, let's say, 1.5 year after regular treatment from a hospital, then every time he was coming for his follow-ups, he was giving some comments which were in a text form, and these comments are actually then reviewed, so that if there were 10 patients coming for a frequent duration of 1 year, then what were the comments from different types of patients, and how is there any indication or any observation which can help us understand the complexity of disease when it is in varying individuals. So you can have some kind of comments from also from the individual patients. Then you have genetic and genomic data. Now this is a very specific kind of data, and genetic and genomic data are only used mainly by the researchers who are actually efficient at analyzing the patterns in the genetic data as well as the genomic data. Now if you go on the internet and try to get some genetic and genomics data, then there are very famous and very prevalent databases like NCBI. We have Gene Expression Omnibus, we have EBI, that is European Molecular Biology Institute, EMBI, and many other secondary databases from where these kind of data can be collected, and any specific questions can be asked by analyzing these genetic and genomic data. The same thing goes with the proteomic data as well. So proteomic data are mainly the data of amino acids, which looks like a string data. And sometimes if for the protein data, we can also go for a 3D structure of a data. So it comes under 3D, three-dimensional 3D imaging data. So you can see for the proteomic, you can go for either a string data type, or we can go for a 3D proteomic data. So we have such a kind of different varieties from where we can get different data. Now let us try to look at what are the advantages of maintaining such data. So the first and the very important advantage is that they are available electronically. Now you just try to understand that if any data of patients is recorded only on their files, that is on paper, then it is very difficult to analyze. It can only be read manually. You can just go through the pages for the previous follow ups and you can just read it again. You can just try to understand, or you can highlight the points which were prevalent in the last visit and again in the last to last visit, and how it has changed. Everything has to be done manually, and then you are completely dependent upon the interpreter, who can be a doctor, who can be a radiologist, who can be a pathologist, who is helping you to understand what is happening with you in the previous follow ups. But if it is available electronically, then we can very well use our resources like our computational analysis very very well, to just to take an information. You can quickly and easily summarize the complete highlights of your data if it is only available electronically, because nowadays we are having scripts, we are having many different tools which can just take the data as input. You just run a small function or a query over the data and it can give you a complete insight. So for example, if I have a COVID-19 data set and it is available electronically means it is available in the form of an Excel file, or it is available in the form of a CSV file, and I'm just able to read it in my tool and I can just summarize. And just after at looking at the summary of the data within seconds, I will be able to understand that what is the number of let's say what is the ratio or proportion of the age. So in the age range, is this disease, is this data coming from only for the patients who are older than 60 years of age, or it is also prevalent in younger population, or else what is the gender population, so how many males and how many females are there. What is the, let's say if it is a COVID-19 data, we could also summarize what is the CT value. So what is the CT value of individuals who are females, CT value of individuals who are males, and all that. So everything can be done very quickly and easily, but the condition is that it should be available electronically. That means it should be the data should be maintained in the form of files on a computer. Now you can see that it is less expensive than obtaining medical record data. So why it is less expensive than obtaining medical record data? You can see that when you are trying to have a medical record data, then you got an MRI and you got an MRI scan. So you got the MRI data scan, and then again you are maintaining it as a file. You got an X-ray scan, you are maintaining it in a file. You're visiting the doctor, you're showing it to the doctors, and then you are trying to get your diagnosis. But nowadays, with the help of artificial intelligence and healthcare informatics, we are having many such tools where you can just put your X-rays or MRIs as input to the tools, and you can just get a basic or the fundamental overview of what is happening actually. So yeah, so it's available for an entire population of patients. So it means that nowadays it is possible that for an Indian population, you are having a one data set which is maintained. For let's say European population, you can have different. And if you go and on Google and search for different healthcare data sets, you will easily see that the US and European info and US and European countries are actually maintaining their data in the form of electronic health records, and many different data sets like data.world, and many different actually data sets, they are repositories they are maintaining only for their population. So nowadays we are also trying to have a population kind of statistics for our own data. So if you are able to collect such electronic data, we can have it for a certain population. It can also be done in community wise. So let's say for only for Maharashtra state we can see that sickle cell is some kind of disease which is very prevalent in Maharashtrian population. So we can just have a population data of Maharashtra, and we can just have an analysis for sickle cell. In this way, these are the advantages, so that we are able to understand what is happening in sickle cell and all that. And now it is rich in clinical detail also, because when you can maintain the patient record, you are maintaining all his parameters. So what is blood pressure on this date, what was the CBC on this date, and all those parameters. So with the duration, you also have the clinical parameters available only in a single record. It's easy for the consumers to understand and relate to the survey results. So nowadays consumers are also very smart, because everybody's handling a smartphone, and if you are already having a such kind of data with you, let's say for myself only, if I have an Excel sheet where I have a complete record of which hospital did I visit in on which date, what was the problem, and what were my parameters, and I can easily look at the health survey and I can understand how my medical history is going. Frankly speaking, we all have been visiting the medical community or the doctors for ourselves, and you only know that for not even for ourselves we are having such a data. If we have all the data scattered in different files, we don't have a prescriptions at one place, and we are not knowing that what kind of medical history we people are going through. So this will be a very good advantage if we are able to maintain it electronically. And it is always efficient means for conveying information and influencing people's decisions and behavior. So now if doctors tell you that after 50 years of age you shouldn't be doing this or shouldn't be doing that, you should walk more, you should eat less, you should sleep well, you know that now you are actually influenced by the decision, right? Why? Because the doctor has a complete record of what is happening to the current population. um, uh, so with this certain age, and if this is the
వింటావా
lifestyle.
వింటావా
uh, Pooja, can you please mute all the participants? Yeah. So it's an efficient means for conveying information, because now doctors can look at the patient history of what is happening with the current population nowadays. You shouldn't be doing this. You shouldn't be eating food from outside or something like that. You should eat twice daily. You should follow this kind of diet and all that. Otherwise, it may lead to cardiovascular diseases in future, or you may have diabetes in future because your genetics say this, because in your family there was something like that, right? So the doctor is easily able to convince you because they are having this information collected over a period of time from different patients, and this is the observation they have made by analyzing that kind of data. So these are the advantages of maintaining healthcare data. Certainly, when we are talking about collecting the healthcare data, there are many different challenges which we have to look at. So when we come to the next slides, and we are going to see what are the different types of healthcare data which can be collected. But before that, let us try to understand what can be the challenges. Because why is it that India is not having a good repository of all the electronic health records for all citizens? Why is it not that with our Aadhaar card we are having our own EHR record maintained? Like we can visit any hospital, but and we can just log in and we can see what is my history, right? So what is the actual challenge in maintaining or creating such data sets? So the first challenge may be questionable accuracy of public reporting. So now you can see that when we are trying to collect this data, we are very much dependent upon what patient is saying. So what the patient is giving feedback upon how he was feeling, maybe he has missed some kind of symptoms to tell you, or maybe he has misinterpreted it's a simple headache but he wants to relate it to some kind of disease, because I have this disease, I'm suffering from this kind of symptom or something like that. So the reporting of the public, whether the information they are giving, is it correct, is it actually accurate, it's very much dependent on it, which we are not sure. So questionable accuracy is there because the reporting may not be completely correct. Another thing is it may not be complete. So completeness is another thing. So you'll see that once people develop some chronic disease, in the initial stages they do not know what was the pattern or what was the issue, because they thought that it is normal. But after, say, let's say year or two when the stage has come to certain level, at that time they think that now it is a chronic disease, but they do not remember what was the initial statistics. So the data may not be complete. Or let's say if he says that I don't know what was my weight at that time, or I do not know what was my CBC values at that time, I have not kept the report properly with me. So you may have some data collected but some data may be missing. So it may not be complete, it may not be timeless. So timeliness. So at it's important in chronic diseases that at what stage what was the symptom, and based on upon that only you come to know what is the progress of that complex disease. So the timeliness information was not available with the doctor, that can also be possible. And the next challenges can be the cost, complexity, time required to compile data across different sites. So for example, let's say I have collected a data on a Google form from some community of patients. When I want to give it to a hospital for certain kind of analysis, or when I want to give it to a data scientist or a healthcare individual, then he may require it in certain other format. And when I want to fit my data on his site, so I'm talking about across the site means when I'm giving it to somebody else, when I want to change my data format to his data format, I may not be able to give him all the attributes or all the features required by him. In that case, again, it's a cost, it's compilation data error, right? I cannot compile it. And the cost and complexity and time required. So we do not know what time we'll require to talk to so many different patients and collect the actual record of the patients. That can also be a problem. Now, very big disadvantages or the challenges that the current use of paper for most of the records. We have been looking that still most of the hospitals are only dependent upon maintaining the patient files on paper, and hence all the information is there only in the form of paper, which means that the trained staff must manually abstract information. So the person who is sitting at the reception and who is talking to the patient to just record what is his BP at the time when he has come, what is the temperature, what is the weight, and what is the symptom he is suffering. If there is a error at that point, it's not recorded correctly on paper, and then he has to put that information again on a excel file. He has to enter the data. He's a data entry operator, so he takes the data from the file and he has to enter it on a sheet or a excel sheet. Then again there can be a problem. So the staff dependency of that staff is also a very big challenge. Cost of survey administration. So survey is floating a form is very easy, but then what is the cost of actually administering the survey? So if you're talking to certain population, you have got the responses, you haven't got the responses, you got the responses, you have to compile it, and then you have to analyze it to get certain observations. So all these costs are actually to be are actually not taken by all the institutes, right? So there are no resources for most of the institutes to go through this complete pipeline of taking the survey and administering it and observing the patterns. The last challenge, which is also very important, is there for possibility of misleading results if questions are worded poorly. So for example, I want to ask a patient a certain thing that when you first got this symptom, whether you this was actually something which was related to this, or with the symptom you got another symptom also, and something like that. I design a Google form to put this question, but the way I write the question is not actually understandable to the population as to what exactly I'm asking. So the interpretation of the question by the population, if it is not done properly, then the responses which I'm getting, they may not be accurate. So wording of the questions. So I word the question poorly. The survey administration procedures are not standardized. There is no standard procedure of administering the survey. I'm just haphazardly just designing some Google forms, getting the responses, and I'm not following any standards. Or let's say the population sampled is not representative of the population as a whole. So let's say when I'm talking about Maharashtra population, and I'm not considering all the communities which come under the Maharashtra population, or all the castes which come under the Maharashtra population. So I talk about Maharashtra population, but I consider only one community. Then the sampling which I have done is not actually representing the population of which I'm talking about. In that case, again, it is a challenge to get this. So all of these are the response bias, right? I'm not getting the response which are desired, but they may be some kind of biased responses. So my complete analytics is going to fail, right, if I'm not having the correct data. That is another. So let us try to now analyze the healthcare process completely, which we are going to discuss in this complete week. Is collect the data, maybe any kind of data. We have right now seen what different kind of data should be there. Once you have collected the data properly, it's standardized, it's pre-processed, it's ready to analyze, then you apply your analysis. When we apply our analysis, it may be applying the machine learning, the statistics, using specific tools for specific observations, analyzing patterns, and so on. And then based upon whatever we have analyzed, making the decisions. Now making decisions means whatever question you were addressing for this process of collecting data or analyzing, you are able to decide what should be done or what is the outcome. Now this block diagram looks very, very simple. Collect data, one block, analyze it, another block, make decision, the third block. But believe me, it's not very simple. I have actually skipped very detailed diagrams of every phase. So the first phase of collection of data is itself very complex, very, very complex. Many different procedures are there. How to collect, what are the standard methods, what are the standard procedures. Once you collect, let's say how you are maintaining, what is the repository, what is the database, is it available to everybody, or the access permissions are not there, what is the access rights. Now how you are maintaining the identity. So identity, you don't want to reveal the identity of the patient to the complete community. So if let's say if you have collected my data, you don't want to declare it on the website or on the database that this is Richa Makijani and she is having such parameters of health, right? So collecting data itself is a very large domain. So I'm just trying to give you an overview of healthcare process, but the first block itself very complex, lot of factors to do, to consider. The second part, analyze it, again very complex and lot of parameters. So basically, because we are talking about computational or applied data science, we are talking about computational methods. So analyzing it in terms of statistical methods, using different tools, applying machine learning. Nowadays we are having deep learning as well, and AI methods to get some information extracted from the collected data, and then based upon that making decisions. That means now interpreting the results which you have obtained from the different models of machine learning or computational models. So interpretation also plays a very important role, because maybe you have done the analysis correctly, but when you are making decision to interpret that this is what my analysis says, at that point also you have to be very careful to say what is the correct information. So now we are doing all this process. What are the questions you want to answer? Now when we talk about healthcare, it is not only computer science, or it is not only the medical fraternity of doctors, or some particular specific community who's trying to do healthcare analytics. Now we have seen right now, even commerce people, the MBA people, the government people, the pharmaceutical people, doctors, as well as computer scientists, data scientists. Everybody is trying to work on healthcare. What is the reason? So there are specific questions which each of these domains want to actually answer based upon the healthcare data. So what are the particular questions? First one is, let's say, pharmaceutical and drug. So designing the drugs for specific diseases. This is now very relevant, and I can actually make it very easy to understand to you people, because right now we have seen the COVID era, and then you had seen that um, a cold and cough drug was actually working for the COVID patients, right? And there were no specific drugs which should be administered by a COVID patient, but there was very simple drugs of cold and cough which we were giving them to them, right? So how did we, the doctors, actually understand that this is a new virus which has come and this drug is working? There was a lot of research going on for the medicines and the molecules. They wanted to analyze which molecule is more effective in treating an ailment. So you may be having molecule A and molecule B, that means the two drugs which are actually existing. So we want to repurpose the drug, right? So for example, if it is a disprin, we have seen that disprin, aspirin are given to heart patients as well. It is a headache medicine given for the headache, right, or migraine, and you are trying to cure it, or you are trying to give it to a heart patient as well. So you are trying to say that the molecule which is the disprin or the aspirin was actually designed for headache, but now it is relevant to cure for heart disease as well. How did you come to this answer, right? So it's the pharmaceutical and the drug industry. There are many molecules or the drugs which we already have, and we can analyze the patterns of the drugs. We can relate them to the diseases which we already have, and we can check whether what is the effect of this drug on a particular disease, and can it be repurposed. So repurposing means what? Initially aspirin was purposed for only headache, but now you repurposed it for some other ailment as well, like we did in the COVID era as well. So healthcare, when we are talking questions we are trying to answer, the pharmaceutical and the drug industry is trying to answer some questions like which molecule is more effective, and maybe should we prefer surgery over medicine. So there is a condition of a patient where both the treatments are possible. For example, surgery can also be done or medicine can also be done, but they will try to understand what can be the effect of this drug on the genetics of this person, and if they are trying to understand that yes, this drug can be effective for this person, then they can delay the surgery and try the drug for some time, right? So these are the questions which healthcare industry may help in that case. Let us try to understand the administration. As I said, now that the government is very much focused on giving this administration, they are trying to actually improve their administration for healthcare by collecting such data and analyzing. So for example, a commercial point of view, the charges to be reimbursed for a treatment. A patient has undergone a treatment at some hospital, and whatever was his billing pattern, and based upon his concessions or based upon his medical insurance which he has with a certain company, what is the amount to be reimbursed to the for this kind of treatment. So this kind of administrative questions are also solved based upon the data which they have collected from the healthcare domain. Which medical equipment may be required by a hospital. So as I said, a hospital is actually having some particular set of some particular disease for which there are many patients which are approaching that hospital. In that case, which medical devices which will be more used by the hospital, that kind of devices may be more procured by the hospital. So this is an administrative decision, but it is based upon data collection. And number of beds required in the ICU. So as I said again, they can just take out what are the patients coming, what is the requirement of ICU in that region, and what is the population, and hence how many ICU beds they should be having. So administrative questions are also very important to be solved using healthcare analytics. And the very prevalent one, which is very well suited to people like us, because we want to do research in machine learning, application of machine learning, data science in healthcare, and for doctors who are specialists in some domain. So for example, the neurologist will be uh, maybe eager to understand that what is the pattern of this, let's say Alzheimer's, what is the pattern of Alzheimer's, how it is growing in patients, how is it growing in only patients with older than 60 years of age, what are the implications, what are the symptoms, whether it is having any other effects on any other organs and all that, right? So how it can be handled, how the patient care can be managed, how the people at their home can be educated so that they can take care of the Alzheimer patients well, and all that, right? They are having emotional setup also, so that they can help the patient emotionally to overcome his or just to live with that disease comfortably. So if there is no treatment for such a neurological disorder, so many specialists want to do some kind of also disease predictions. So prediction is something very relevant to computer science. And what are we actually trying to do in predictions is which symptoms are prevalent in particular diseases. So in general, if you go to a doctor, right, doctor has a set of questions that if you're feeling headache, if you're feeling vomiting, and this are this, if this is the three patterns you are having, then this is a migraine case, right? So these are the questions which are actually developed. So we can take a set of questions for different kind of diseases. If a patient is suffering from migraine as well as diabetes as well as blood pressure, then you can be having a set of parameters for all those, and all those features in combination, how they are actually are they leading to a new disease in the patient, right? So you can have such a kind of analysis for predicting. So I can have a prediction that you can also see that there are so many different ML and AI applications available now, which can actually tell you whether you may be suffering from cardiovascular disease after, let's say, 2 years, because of your lifestyle patterns which you are feeding to it. So you're telling that I'm being eating this is the calories I'm having. You have smart gadgets which can measure the heart rate, which can measure your calories which you have burnt, and your what is the amount of exercise you have been doing, and then they can suggest you something, right? So these are the prediction questions. So you may be prone to a particular disease in some time, it can tell you after prediction. Also, we can say which gender or age is most affected by certain attributes. So females are getting this kind of diseases more than males. You can have that kind of uh, question also answered. You can have a prediction duration of hospital administration of a patient. So when a patient is administered to a hospital for a critical case, then you are not aware that, or you don't have an idea that what is the amount of time he may be spending. He may be there in the ICU for a month or for a two, or he may take 6 months. You are not aware. So now you are having prediction tools with the help of healthcare informatics, that based upon the patient parameters which are taken daily when he is administered to the ICU, and how he is improving, the tool itself can tell you what is the duration he may stay in the hospital. So it can tell you the predicted duration is, let's say, approximate a month, or it can be 15 days as well. So these are also important questions. So nowadays hospitals are also trying to get such applications, artificial intelligent applications, which can help them make administration decisions more easy, so that after one month they will be sure that at least we will be having one bed free for a certain patient. And the last one is predicting life expectancy of individuals. This is also very important, particularly in, let's say, cancer disease. So it's a progressive disease which happens in stages. And if you have certain data collected for, let's say, stage one, then you have data collected for stage two of the same patient, it will be able to help you to predict what is the life expectancy of that patient. If he is improving, he'll tell you, the tool can tell you that the life expectancy is increasing. Or if there is no progress, then life expectancy is at danger. What is the percentage life expectancy? This is also a good computational problem which we solve for healthcare. So I'll now quickly go through what are the types of data, and I'll just try to show you what are the data formats. Having said that, this is the complete healthcare domain which we are trying to address. The types of data which we can have are electronic health records. Electronic health records are nothing but the patient medical records in the form of some file in your computer, the Excel file, the CSV file, or something. So EHRs are not very prevalent. We do not have a concrete EHR data for Indian population, but if you look, you'll get the EHR data for US and maybe for European populations as well. Administrative data for hospital administration, number of beds, ICUs, what types of patients are visiting, how many males are visiting, how many females are visiting, what is the age of patients which are mostly coming to the hospital, how many children are administered to the hospital, for which type of disorder. So nowadays you will see that if there is a hospital which is having a psychological unit as well, and if you have a child psychologist, there may be more number of children visiting the child psychologist more than the cardiovascular disease, for example, in that region, right? So there is some demographic region where the environment is not very favorable for children, and then they are mostly depressed. So you can have that kind of analysis as well if we have administrative data collected. Next comes the claims data. So healthcare industry is working very rigorously now, and we have so many different health insurance uh, health insurance companies which are actually tying up with these hospitals, and then we are having all our mediclaims and all that to be settled. So the claims data will also be related to your healthcare data, so that the patient claims can be settled through the company. Patient or disease registries. So patient or disease registries are this is a kind of data where the patient records is maintained for a particular disease. For example, so what is there in the bracket is I have stated some examples, like we have the Global Alzheimer's Association Interactive Network. So only for Alzheimer's, so people want to address the Alzheimer's disease, they are trying to maintain their own association or a network of data called as Global Alzheimer's Association Interactive Network. So they are trying to have all the data of Alzheimer's patient at one place. National Cardiovascular Data Registry, or the cardiovascular data patients data or can be registered, and we can find it here. National Program for Cancer Registries, again for cancer, this is coming from the US. And health surveys, we can have health surveys data also available. So we have Medicare current beneficiary survey, this is one health survey data. National Health and Nutrition Examination Survey, another survey data. Like our government is also proposing the nutrition or health survey data for children in the rural areas, that can be one survey data which can be a healthcare data. And we have National Medical Expenditure Survey data also, so which country is spending how much amount for their medical sector or for their health, administration of health. We can have such kind of survey data as well. And then we have clinical trials data. So for example, the clinical trials for a certain disease, again you have clinical trials.gov is one place where we can get such data. WHO International Clinical Trials Registry platform, and open trials, these are certain examples of these types of data. So you can see there are so many different varieties of data. For each variety of data, it can be available on different repository or platform. Where should we get this data, or how do we collect this data? What are the sources? So you have computerized clinical data, which is maintained by the hospitals or some clinics, some patients. You have patient data from EPRs, electronic patient records, data from clinical support systems, for example, written notes and prescriptions. So this is coming from our patient file, right? So what we generally have in India, the patient file, notes and prescriptions. So you have gathered this data. You have medical imaging data like the x-rays and MRIs, some lab work, so the pathological reports, pharmacy, what type of medication they have been prescribed, what is the insurance policies the patient is having, and other administrative data. So this can also be one of the source. Another source can be machine generated medical data. So for example, machine generated in the sense, for easy example is ECG. So you have some signals taken by that device, ECG device, and then there is a report which comes in the form of signals ups and downs, right? So that is a machine generated medical data. Even we can take that data and we can process the signals which are prevalent in that ECG. Also nowadays, this is also very prevalent, patient generated social media posts. So on Twitter, on Facebook, on other platforms, on blogs, on websites, you can also find many different healthcare information available which can be used for analysis of a certain disease. For example, from Facebook, can we actually do, I'm just asking a question, can we actually do analysis of how happy a population is in a certain region? or in a certain friends group how happier people are. So I always keep on posting, let's say, only messages which are very depressing. It shows that my mood is very depressing. Am I right? Correct. So mental health, that comes under mental health. What are your emotions? That can also be seen from your posts, and that can be analyzed. Smartphone health apps, so many different healthcare applications are there on available on your Google Play Store. You can just download and you can have a good feedback of your health. Emergency care data from the hospitals, and news and medical journal articles, that is literature. This is important for the researchers, because when we want to try to understand any disease, we actually first try to read the literature. What are the genetics important in that disease, from where should we get the data, what are the observations already reported, and what is that which we can actually do in that domain. Very roughly, I've tried to give you a data set of data agencies in India. You can see the CGHS, that is the central government health scheme. This is the place where we have these are the agencies which are actually trying to maintain data for let's say the government employees. Central government health scheme, you can have private hospitals maintaining data. We can have certain NGOs, let's say, working for mental care, NGOs working for cancer, NGOs working for diabetes and all those. NRHM, National Rural Health Mission. So NRHM is actually working with the rural population. So what is the nutrition pattern? What is the prevalent disease in the rural India, and how it can be handled? Some research institutes like AIMS, NCI are also trying to maintain certain data. And central medical institutes, like at Nagpur, we have SIMS Institute, which is also having data for all the patients being taking treatment at that place. Here comes now, after looking at so many different types of data and domains, what is a data format which we have to deal with? Because we are talking about applied data science, we want to actually apply the data science concepts onto the data. Now, first thing we should have is the data. Second thing is what is the format of the data, and then based upon the format, how can we process it, how we can analyze it to find our observations. So let's broadly look at what can be the data formats. You can have a textual data. Textual data is in the form of written text, can be in the Word document, it can be in a PDF, right? So I can have my report in a PDF form, my COVID-19 report in PDF form. That becomes a textual data. And I want to analyze many such textual data. I want to extract the information given in that text, and I want to observe what is the pattern. So one of the pattern of the data, format of the data, is textual. Another can be voice, speech, or narrative. So for example, basically in neurodegenerative disorders which are related to mental health, many times in Alzheimer's as well, in dementia as well, the voice patterns are collected of the patients. Based upon the voice patterns, we try to analyze what is the stage of the Alzheimer's they are going through. So you can have another format also. So in a very good domain called as natural language processing, NLP, in for healthcare, many such data are getting analyzed, and natural language processing tools are applied, methods are applied to get some observation from voice data. So you can have textual, we have discussed voice. You can have numeric data as well. Numeric is in the form of numbers. So some number data, I'll show you the format, how does it look like. You can have images, for example, X-rays, MRIs and all those. I can have image data. I can have chemical data in the form of, again, strings, or I can have certain 3D structures, chemical 3D structures, and I want to analyze that. I can have genetic or genomic data. Again, it is in the form of string data. So computer scientists understand what is a string. It is just ABCD kind of text, right? It's a string data. And then we have methods in computer to analyze that string data. Or it can be a network data. So network data like protein-protein interaction networks. So or the disease and the drug network. So you have a disease, and for that disease you have a set of genes which is the causative agents in that disease. And then for drugs you have certain molecules. Now you have two networks which are designed, networks in the form of nodes and edges. One data in the form of nodes and edges, another data in the form of nodes and edges, and then we are trying to merge those two, or we are trying to have what is the association of a drug on a particular disease. That is called as disease gene network. Many such different networks are available, and we can have many such insights over the network analysis as well. So the common data types which will be used for these are quantitative data and qualitative data. As the name quantitative suggests, it is a measurable, right? Quantity 1, 2, 3, 4. We can measure it. It's measurable. It's basically a counting. And the example is age. It's countable, right? 60 years of age, weight, temperature, all these are numbers. Or the number of people suffering from diabetes. It's again a number. So we can have quantitative data or we can have any qualitative data. Qualitative is non-numerical. It's not in numbers. It can be observed, but it cannot be measured. For example, it involves observing people in selected places and listening to discover how they feel and why. So I'm observing a particular school. Let's say I'm visiting a particular school and I'm always talking to students of between 8th to 10th grade. So these are the students who are actually going through changes, like adolescence. They are moving towards the teenagers and all that, and I can observe what is the patterns of their behavior. So it involves listening to them and discovering how they are feeling and why they are feeling. It's not quantitative, but it is qualitative. So example, how many smokers non so whether it's smoker or non-smoker is there, why he's a smoker or a non-smoker. Questionnaire response, for example, agree, disagree, neutral, right? How many males and females are doing smoking, non-smoking, what are the reasons behind it, what is the behavioral pattern, and whether they agree to certain questions, disagree to certain questions, or they are neutral, they don't have any answer to those questions. This kind of data will come under qualitative data. Now, I'll just try to show you certain formats of the data which we have talked on right now. I told you that one format can be an image data example, and we have tried to show some pneumonia data here. So if I go on the internet, I want to do some kind of image analysis for a certain disease, like let's say pneumonia. So you can see I am just trying to collect an X-ray data. So this is a text X-ray in different pneumonia conditions. So the first condition is normal, another is bacterial pneumonia, and the third one is viral pneumonia. Now I can have my image analysis algorithms running on such data sets of images, and it can help me analyze the pattern, what I can see here, what I can see here, what I can see here, and then I can have such kind of analysis for my image. If I have a numerical data, we have seen actually numerical data many times during COVID. Data.world was actually putting all such numerical data on the website, daily updates of how many cases, what are the CT values, how many how much population of from which country, how many males, how many females, what is the age of the people suffering, and all that. So we were actually seeing that. So numerical data, I was here. So you can see how does it look like. Why it is numerical? Because you can see these are the attributes. The columns which are there are the attributes or the features, and these columns are having numbers. So this becomes a numerical data. So let's say Maharashtra state, total cases are this, total deaths are this. So this is the data taken from 2020. May 2020, and it shows you numerical data. So I can have this kind of data in my Excel or in CSV, and then I will have relevant methods to analyze such numerical data. This is another format. Yet another format can be many different, which I have not shown here. The signal data like the ECG, EEG, and many others, right? We are not talking about it right now. We'll be dealing with those in particular sessions which we have planned for a workshop. So I'll just try to show you. There are actually some success stories which I've taken from this website. North Shore reduces hospitalizations with predictive analysis. So number of people going to the hospital for administration have reduced, right? How? Based upon the predictive analysis. So what are they doing? They are using data and predictive analysis to help determine which chest pain patient should be admitted for observation. So we know that chest pain may be due to your some acidity or stomach related issues as well. So they are having predictive analytics. They take the data of the patient, they analyze the behavior of how the chest pain is, and then they tell you whether the chest pain is actually relevant to some cardiovascular problem or not. Otherwise the patient can go home, right, if it is not related. So North Shore has reduced the hospitalizations using predictive analysis. This is a success story. Data as a service platform helps JHS improve care. So again, we have some hospital, JHS, and they improve the care. They use home grade data as a service platform as a strategic differentiator to improve patient care while cutting costs. So patient care management, right? How do you feeling today? You should eat today. You should do this exercise today. Your application is telling data as a service platform, right? And then based upon that, you are improving the patient care and you are cutting down the cost. So you're not visiting the doctors frequently. You're not taking medication very frequently. So cost cutting can be seen as one of the success. Pen medicine uses real-time data to shorten ICU stays. So real-time data it is collecting and it is shortening the ICU stays based upon proper medication on time, right? So when you go to the ICU only when the condition is very has worsened. So before that point itself, the condition has been taken care. And what it's doing, it's also building a dashboard. So it takes a real time data of EHR to alert the respiratory and nursing staff when interventions are needed. So these are also so real time data is taken by the patient, and then they alert the nursing staff when interventions are needed. So there shouldn't be a nurse every time. The nurse will be alerted if the readings go up and down, only then the staff should visit. So these are the healthcare success stories which are there. What is happening in India? I just wanted to show you something related to this. So I just put a slide called as healthcare startups in India. So many different startups have tried to have started their working in healthcare now. Out of which I think everybody is aware of Healthify Me. We can see it in the advertisements, correct? Healthify Me. Yeah, I'll be happy if I get responses in the chat. Yeah, right. Healthify Me is very popular now because we can see it in the advertisements. So this is a good startup. SigTuple is another startup. Innovator, Assistant, HealthPix, Tricog, and all those. You can see these are all healthcare startups in India. And what are they actually trying to deliver? So they are actually working in different sectors. For example, service delivery. So for example, there is one more app which I may be missing, which is delivering the medicines at your doorsteps, right? I am not able to recall the name of that application, but it is there. So delivery services for healthcare, that is one administrative domain, right? They are working. Providing services to the healthcare for healthcare. Pharmaceutical products, for example, many different pharmacy products are now available on the particular websites, and those pharmacy products can be delivered in hand. You don't need to visit the shops and all that. Eating habits, fitness, lifestyle, which relates to Healthify Me. So what kind of exercise we should be doing, what is the heart rate, what are the calories we have burned today, everything is related to healthcare. The workout apps, which can help you every day. You should do these kind of exercises and yogas. Patient health management apps, so I can put my parameters daily in some health management application which is taking what is the my temperature today, what is my mood today, what have I eaten today, and everything, and I can have such a record. Health management, or let's say only for diabetes patient, what he should do, what he should not do is there in his app, and he or she is continuously being there for how it can be handled. And then we have telemedicine as well. Telemedicine is also one of the very important healthcare domains where you do not actually have a doctor, you don't need to visit a doctor, but there is an application. I suppose Practo is one of those. You can just log in into the application, you can tell what are the symptoms, you can chat with the administrator there, and it can have some suggestions of what you should do if this is the condition with you, right? Telemedicine. So using the technology to get your medicine in hand without visiting the doctor. So these are so many different domains in healthcare where everybody is trying to put efforts, and they are trying to help the industry evolve. These are healthcare startups in India. This is a format of the text data which I showed you. One format was missing earlier. So patient, you can see there are patient dashboards like this, and all of this is some text which is embedded on this screen. You can see, so 76% current bed occupancy rate, patients, and all those. It can be in a PDF format, and I just want to analyze this PDF to understand that what are the implications of the disease, or how this monthly report of this patient, what the monthly report of this patient is showing on a dashboard. This is a textual data format. So that's all about the session on introduction to data. I think I've tried to cover what are the different types of data formats which can be there, what are different sources, how different people from different domains want to work on healthcare so that the industry evolves. If there are any questions, I'll be happy to take those. So after this session, questions, we are having our inaugural ceremony at 11:15. Everybody please stay here with the meeting. 11:15, our authorities will also be joining, our speakers will also be joining. We'll be having a short introduction and in the inauguration ceremony, after which we'll have a next session at 11:30. If there are any questions, I'll be happy to answer, please. You can put your questions in the chat. Thank you, Dr. Sarvana Babu. Informative presentation, you say. Thank you. Any questions? Yeah, there is one question. How to analyze quantitative and qualitative data. So, quantitative and qualitative data have to be dealt with different types of analysis pipelines. Because quantitative data is generally numerical, you have certain statistical procedures which we can apply, and there are different machine learning models which we can work on quantitative data. When we talk about qualitative data, the qualitative data has to be converted maybe in some kind of it can be coded so that we are able to make it quantitative first and then we can apply our data, or else we have to convert it into categorical first. So qualitative is like liking, disliking, not liking, not knowing. So these can be four categories. So let's say if I want to analyze such data, I can have such a kind of encoding where I say, let's say liking is category 0 or the number 0, not liking number 1, disliking not knowing number 3, number 4, and so on. So I can have such categories. So I need some pre-processing so that the qualitative data is first converted into a certain format which is ready for analysis, and then I can go ahead for applying my ML pipelines, machine learning pipelines. I hope I answered that. Yeah. One more question: how verbatical surveys are analyzed? That is more of yes or no answer and some text. So, more of the yes and no answer, we try to make it only 0 or 1. That means we want to try to make it binary. So, once it is in binary, then it is remaining is the text. Now, text is dependent whether if the text is just a category, like I said, liking is one category, disliking is another category, or the text is actually something very big sentence. Let's say this is happening, so I'm not feeling good or something like that. Now if it is that kind of text, then we actually want to apply NLP. We want to get the information extracted from that text. We'll have some keywords. So let's say I'm liking this, I'm not like, somewhere he says I like this because I'm not eating because something like that, if that is a text. So I'll just pick up the keywords of liking, eating, and then I try to relate something to those two keywords, and then I want to again make it categorical. So there is a lot of complexity in such data sets. If it is only 0, yes and no, it's easy. We can make it binary. If it is having text, we apply our NLP pipelines and again bring it to the format of numerical way. One more question from Ravi Prasad. Complete session is centric to healthcare domain. Thanks. Can we get the PPTs? Yeah, surely we can share the PPTs with you. No issues. So we'll be in the lab session today. We'll be sharing with you a drive link where we'll have the lab session material, as well as we can share the PPTs there. So you'll get it easily. We just want you to be connected with us for the complete 4 sessions. Yeah. One more question. What is the minimum sample size required for ML analysis? So, sir, there is no actually upfront answer to this question that should be the minimal sample size. But yes, we generally start with few hundreds at least. For example, more than 500 or something. If it is in thousands, if it is in 10, 100,000, it's very, very nice to have a more deeper model for learning. It depends upon which type of data we are actually trying to analyze. Right. Right, so it's 11:10 now. Let us take 5 minutes of break. Please be here. Please don't disconnect with the session, and we can again start at 11:15 with the inaugural session. Thank you. Stay connected. Good morning, sir. Dakle, sir. Sir, your voice is not clear.
हो गया ठीक है झालं हो गया Richa, can I hear you? Can I hear me?
Yes, sir. Yes, sir. You're audible now. Sir, shall we start?
Yeah.
Thank you, sir. Once again, good morning, all of you, to all the participants present here. I welcome you all to the fifth 5-day workshop on applied data science and healthcare. We have with us today respected Registrar IIIT Nagpur, Shri Kailash Dakle, HOD Computer Science and Engineering, Dr. Tausif Diwan, sir, with us. Warm welcome to you all, sir. We have gathered for the inaugural ceremony of this workshop. Healthcare is the improvement of health via the preventive diagnosis, treatment, or cure of disease, illness, injury, or other physical and mental impairments in people. Healthcare has become one of the India's largest sectors, both in terms of revenue and employment. Computer science can improve healthcare in various ways, including digital health, data analysis, medical decision making, telemedicine, computational modeling, and electronic medical records. So, the objectives of this workshop are to impart working knowledge in data science for healthcare to students and faculty from medical as well as engineering background, and bringing together engineers and medical professionals for discussing open challenges in healthcare domain and exploiting the use of machine learning. I felt delighted to share that we have got participants for this workshop from all over the country, including MGM School of Biomedical Sciences, Navi Mumbai, Indian Institute of Science Education and Research, ISAR, Kolkata, Institute of Computer Science Department, Vikram University, Ujjain, Manipal University, Jaipur, Rajasthan, MIT ADT University, Pune, Chaitanya Bharati Institute of Technology, Telangana, JSS College of Pharmacy, Mysuru, University of Hyderabad, Department of Pharmacology, Central University, Punjab, Bhatinda, Walchand College of Engineering, Sangli, SIMS, Nagpur, VNIT, Nagpur, GHRC, Nagpur, RCEOEM, Nagpur, Faculty of Engineering and Technology, DMI, HER, Savangi, Wardha, SVPCT, Nagpur, Shri Ayurveda Mahavidyalaya, Nagpur, Priyadarshini Bhagwati College of Engineering, Nagpur, and Kishoritai Bhoyar College of Pharmacy, Kamti. We have very good invited speakers from all over the country, and I'll just try to introduce the speakers to all. We have with us Dr. Dhananjay Raje, Head Data Analysis Group's MDS Bioanalytics. He started his career in 1997 as scientist in National Environmental Engineering Research Institute, NEERI, Nagpur. After 2005, he joined Oculum Biosolutions, Hyderabad, and was involved in clinical genomics. Then he joined TCS, Mumbai, as Program Manager Biostatistics. In 2011, he joined MDS Bioanalytics as Data Analytics Head. He is presently operating as independent statistical consultant, providing data analysis services to various medical research organizations and pharma companies. He has published 82 articles in various national international journals with different collaborators. In 2016, he was awarded with Chartered Statistician status from Royal Statistical Society, London, which is the highest honor of any statistician by the society. He is a biostatistics editor for International Journal of Diabetes in Developing Countries. We welcome you, Dr. Dhananjay Raje, sir. We have with us Dr. Tausif Diwan, HOD CSE IIIT Nagpur. He completed PhD in parallel computing from CSE Department, VNIT Nagpur in 2017. His research areas include parallel computing, machine learning, deep learning. He is NVIDIA certified DLI instructor for the foundation of deep learning and building transformer based natural language processing applications. And he secured Platinum Award as a DLI instructor from NVIDIA in the year 2022. He has an Australian patent titled an IoT based smart food cold chain transportation system to his account. Welcome, Tausif Diwan sir. We have Dr. Tripti Singh with us from Department of Computer Science and Engineering, Amrita School of Computing, Bangalore, as one of our speakers. She is senior IEEE member and has 18 plus years of experience. She holds her engineering graduation in electronics and instrumentation from SGSITS Indore, Masters of Information Technology from IIITM Gwalior, and Doctor in Medical Image Processing from MITS RJTU, Madhya Pradesh. Her areas of interest include biomedical image processing, AI, deep learning, and machine learning. She has secured several international awards that include the Best Idea Award in 3 Bs, Young International Investigator Award. She has been organizing chair at 11th International Conference on Computing, Communication and Network Technologies at Indian Institute of Technology, Kharagpur, West Bengal in 2020, and organizing chair of 12th, 13th and 14th held at various IITs. Recently, she has taken 3 months classes on AI in healthcare for doctors. We welcome you, Dr. Amrita ma'am. Another speaker we have is Dr. Kavita Tewani, working as project manager at Topia Technologies for project AI in drug discovery. She has more than 9 years of experience in industry, academic and research. Previously, she was working as assistant professor in computer engineering department at Nirma University, Ahmedabad and ITM University, Vadodara. We welcome you, Dr. Kavita Tewani. Dr. Snehal Shinde, Assistant Professor, Symbiosis Institute of Technology, Nagpur. She is currently working as Assistant Professor at Symbiosis International University. Prior to that, she worked at Vellore Institute of Technology, VIT AP campus, the State Government Institute, Walchand College of Engineering, Sangli, and Vishwakarma University. She has completed her PhD from VNIT Nagpur in the field of computational biology, and she has 1 year of industry experience at Infosys. We welcome you, Dr. Snehal Shinde. We have Dr. Chandra Mohan with us. He is Assistant Professor, IIIT Sri City Chittoor, and his areas of interest are computational biology. He has a lot of research articles to his work in this field. We welcome you, Dr. Chandra Mohan. We also have Dr. Manish Kurhekar, Associate Professor, VNIT Nagpur, as one of the speakers. He has completed BE from VNIT, ME from IIT Bombay, and PhD from VNIT. He has 14 years of industrial experience and has worked in Persistent Systems Limited, IBM India Research Lab, and as a software engineer at Texas Instruments. He is also having 13 years of teaching experience at VNIT. We welcome Dr. Manish Kurhekar, sir. We have Dr. Maitreya Meti with us, IIT Kharagpur, a young fellow, faculty fellow in iHub Data at International Institute of Technology, Hyderabad. He received PhD in Healthcare AI from IIT Kharagpur. His research interest is in biomedical image informatics, diagnostic software application development, and smart biomedical device design. He published his research in Journals of Medical Systems, Journal of Medical and Biological Engineering, and he served as a reviewer in journal including IEEE Transactions. So other than that, we are have me and Nilesh, Dr. Nilesh Pikre will also be the coordinators of the workshop as well as speakers for few sessions. So we welcome all the speakers and participants to this 5-day workshop. And I now request our respected registrar, Shri Kailash Dakle, to please address the audience. Please, sir.
Okay, thank you, Dr. Richa. Good morning to all of you. On behalf of the Director IIIT Nagpur and IIIT Nagpur family, I welcome all the participants, faculty members, and respected speaker. First of all, I congratulate organizer Dr. Richa Makhijani and Dr. Pikle, who has organized 5 days workshop on applied data science for healthcare. Both my faculties had worked hard and days come to for inauguration today. As Dr. Makijani informed that all the corner of India people has participated in this workshops. In olden days, technology and medical science were the different stream, and they were definitely go away 360 degrees away apart from this technology plus sciences. But nowadays, it is very essential hand by hand, because medical science people, and particular in the patient, hospital have lot of data, but they don't know how to compile it and how to find out the solution for their result. When the patient is admitted in the hospital, they have to go through long trial. Sometimes doctor also doesn't know which patient need the which medicine. But if technology and medical science come together, they will give the very good result. I am happy to share you that IIIT Nagpur how the 3 MOU with the Medical College of Nagpur, and Dr. Makijani is one of the PI project, and that all one of the colleges, they are giving the very good results. In futures, that project is going to complete it, and in data science, they have given the very nice result and which is applicable in futures. So during these 5 days, I really happy to know that all the participants take the advantage of this workshop and make some implementation in futures. Result of technology and medical science is very good, and which is generally in public and particular in individual in future. I wish you all the best to all the participants, and thanks once again to organizer Dr. Richa Makejani and Dr. Pikle. Thank you, Richa.
Thank you so much for your encouraging words, sir, and your support that you have extended always. Thank you so much.
Thank you. Thank you.
Thank you, Tausif sir, also for joining. Thank you, all other speakers, also for joining. Okay, so we have completed the inauguration ceremony now. Thank you, all the speakers. We'll continue with our next session now with Dr. Dhananjay Raje. I request all the participants to stay connected. The speakers can now leave the meeting. We'll meet again in the respective sessions. Thank you so much. So according to our schedule, let us start with the next session of our plan. We have with us Dr. Dhananjay Raje with us. I request Dr. Dhananjay to please take over the meeting for the upcoming session. Sir, we cannot hear you.
Hello.
Yes, sir. Now you're
Yeah.
audible.
Okay. So good morning, everyone. And first of all, thanks, Dr. Richa and the director for inviting me here for giving some of my presenting some of my experiences in the field of data analytics, especially in the clinical domain. So in next 1 hour, 1 hour or so, I'll be just running you through some of the basic statistical terminologies and how we approach for data analysis. And then I'll just run you through some of the ways of how the data, quantitative and qualitative data, can be handled and analyzed, and what are the questions that usually this in medical domain, these practitioners or researchers, they face, and how statistics, as well as now with the recent trends, the machine learning and artificial intelligence tools, they can help in addressing those questions what these researchers they have. So today I'll not be talking about ML and artificial intelligence, but we'll be talking only on the basic statistics, because I'm interacting with medical professionals and in India as well as abroad. So at present, what I have realized that machine learning and all is something at a much higher level to their understanding. But yes, most of the researchers in medical domain, they undergo through some statistical courses in their um, PGs or during their doctoral programs and all. And so to certain extent, they can have a good understanding of the statistical terminologies and what these statistical tools they can help in understanding their questions, answering their questions. So that is somewhat a comfort zone for them. But machine learning and artificial intelligence, perhaps the time is yet to come for these people to really understand as to what is happening inside and what is computer is doing for them. So with their by using their data. So today we will just run through some of the statistical techniques, some preliminary things, because uh, there are certain core and basic things which these people, they first of all should basically the medical professionals, they first of all should know, and then gradually step up for doing some higher level analytics to answer their queries or questions. So I'll just, I think I can share the screen. I think so. Can everyone see the screen?
Yes, sir. It's visible.
Yes, sir. It's visible.
Okay, okay. Okay, so we'll be talking specifically about the statistical data handling and manipulation. So what is, uh, I'll just So what is statistics? It's basically a science concerned with collection, organization, summarization, analysis of data, followed by drawing inferences about the body of data when only a part of the data is observed. Whenever we do such kind of analytics, we don't play with the entire data set, but we observe only part of the data, which is what we say a sample from the population, and then try to understand how the population characteristics could be based on that particular sample. So this is what basically the entire theory of statistics it relies on. So during this process, now when we usually in any domain, we have certain questions in mind. So they are basically the questions from the domain experts. And for answering those questions, what we require is some evidence, that is some data. Now this data could be qualitative, quantitative, and then we have to do some analysis of that data using statistical tools or and then now recent machine learning tools and so on. And then finally, we try to draw the conclusion about it, like, and try to answer the question. So this is basically the problem which we have in real life, and what we need to we need to answer. So when we talk of data, so there are different steps that are associated with this data, which is data collection, then data organization, I'll just come to that. So data organization, data summarization, and data analysis. So each of this step is very important, because eventually when you are answering the question raised by the domain expert, the reliability of the data is the first and foremost thing, which is very important. So right from the data collection till data analysis, at every step, we need to be very cautious as to how we are going to answer and what is the degree of confidence level what we have in answering this particular answering the question. So it starts with data collection. I think Dr. Richa already talked about like what are the how the data collection can be done now with these recent technologies which are there. Um, then we have data organization, how the data, whatever has been collected, how we are going to organize it, how we are going to understand it. Then next is the data summarization, and then the analysis. So these are the some of the steps which are there in the entire process when we play with the data. So we just start with data collection. Now, uh, when it comes to data collection, we define certain. I've just shown you that there is certain hypothesis, there is certain question that is in our mind, and on that particular to answer that particular question, we need to generate the evidence. We need to generate the data. Now, the data structures we will see later on. Dr. Richa has already also covered that, but we need to capture the data. We need to collect the data. Now, it's not possible every time to screen or to go through the entire population when it is especially maybe some epidemiological study or